Substance use disorders occur when the recurrent use of alcohol and/or drugs causes clinically significant impairment, including health problems, disability, and failure to meet major responsibilities at home, school, or work. Coming up on Polk Place, we'll discuss services available for those in need. Welcome to Polk Place. I'm your host, Mason Chambliss, and today I have with me Ms. Donna Renninger, Director of Specialty Services at Peace River Center. So nice to have you with us today.
Thank you.
So tell us a little bit about your title and what you do at Peace River Center.
My name's Donna Renninger, and I'm the Director of Specialty Services at Peace River Center, and that includes several programs such as the Florida Assertive Community Treatment Program, the Community Action Team for Children. It's a program similar to the FACT team, but for children. The Substance Abuse Program, and Family Intensive Treatment.
So today we're talking a little bit about substance use services that Peace River Center offers. Just jumping right on in, can you tell us how prevalent substance use is in America?
Well, about 40 million Americans ages 12 years old and older, that's 1 in 7 people, have an addiction to either nicotine, alcohol, or other drugs. That's more than the number of Americans that have heart disease, diabetes, and even cancer. You can get a better picture of what's happening here in Florida if you look at last year's report for the Florida Medical Examiners Commission. They have reported significantly increased drug-related deaths with several different types of drugs, including stimulants, fentanyl, heroin, cocaine, meth, and then synthetic marijuana.
So you mentioned nicotine, stimulants, all of these different substances. What might cause somebody to become addicted to these things?
There's a lot of different reasons. People don't just wake up in the morning and think they'll become addicted. It's usually a very slow process. Hereditary has a lot to do with it. If there's people in their family that have addictions to certain things, they're more apt to develop an addiction. But usually it starts off with just recreational use of one drug or another. Most of the time, the drugs that are not as potent, such as marijuana, or they may try some alcohol, and then over time, as they add more and more and more, the body starts to build up a tolerance, and they need more of the substance to get the same effect. And it's usually just like a ball rolling down here. Well, it gets bigger and bigger and bigger as it goes along. And then they realize it's totally out of their control. So it's usually something that happens over a time period. It's not something that happens right away in the first use.
So let's say someone does have a substance use problem and they're using, and what are some of the first red flags, some of the first signs that you might have crossed over just from recreational use to actually becoming addicted?
It could be frequent injuries, aggressive or argumentative type behaviors, obvious signs of intoxication like a dizziness or bizarre kinds of behavior. You may see loss of interest in their usual activities or hobbies, or isolating themselves, not participating in activities that they normally would. You may smell an odor of alcohol or like a chemical smell on their clothing or even on their breath. There may be work or school-related issues, increased absences, poor performance, disciplinary problems. You may see weight loss, or you might even see weight gain. And then, of course, there's changes in behavior, such as their choice of friends, or their eating habits, or mood fluctuations, their dress or their hygiene habits.
Okay, so these are all things to watch out for if you or a loved one, start making any sudden changes in any of these kind of behaviors. Could possibly be a red flag.
Right.
One of these. So Peace River Center has a substance use program.
Yes.
So tell me a little bit about what the program entails and what goes on there.
Well, all substance use program start with an evaluation. You need to determine what level of treatment is needed. So they'll begin with an evaluation, and then based on that evaluation, the level of treatment will be determined of what they specifically need. We have different levels of treatment. We have programs for adolescents in our teen program, and then with adults we have various levels of treatment, including the basic level, a more intensive level, and then aftercare. But all of our treatment, our substance use treatment at Peace River Center includes group therapy as well as weekly, individual, or family counseling.
Okay, so for this program that you guys offer, starting with making an appointment or however it might be, how do you get enrolled into this program?
Well, the first thing is to call our appointment line and ask for an evaluation, and our appointment line is 863-248-3311. You can just call and you ask for a substance abuse evaluation. It's just that easy.
So if someone made an appointment and they came into their evaluation, and after the evaluation it was determined that they might need a more intensive level of care, what would that look like?
Well, at an intensive level of treatment, we have 10 hours of treatment per week for the person, and the minimum time is usually about 12 weeks or 4 months. It can last a little bit longer depending on how well they do while they're in treatment. But during that time frame, every week, they're going to come in 3 times a week for groups, 3-hour groups each time. And then they're going to come in a 4th time in the week where they'd have individual one-on-one with their therapist. The groups that they go to will help them learn those coping skills and learn what causes addiction and the effects that it has on the brain. And then the individual session or the family session, if they want to bring their family in, it can help them learn, have that one-on-one time with their therapist to help them understand how they can incorporate what they've learned in group into their individual lives and where their personal barriers are and how to overcome them, and discuss their progress in that and get feedback from a therapist to help them be able to live what they're learning on a day-to-day basis and to stay sober. We also do random drug testing throughout the whole treatment period, so at any time, and they don't know when it could happen, at any time we could request a random drug screen, so that helps monitor how they're doing also in the program.
Okay, so if someone were to fail a drug test, would they just start from the beginning of the program again, or what happens?
No, and that's to be expected, that they're going to have relapses along the way. It might lengthen their time in treatment. Instead of 4 months, it might last 5 or even 6 months of treatment. So because we want to have at least 30 days of sober living at the end before sending them out into the community to take those skills with them that they learn and be able to maintain that once they're out in the community and they don't have the oversight of a program helping them to stay sober in the community.
You mentioned that sometimes patients will bring their families in to group therapy sessions with them. What are some of the positive effects of that?
They don't bring them into group. They'll bring them into their individual sessions.
Okay.
But the purpose of that is addiction affects the whole family. And a lot of times when a person is addicted to a substance, it really hurts the relationships within the family itself. It causes a lot of problems. There's a lot of mistrust. And so having the whole family involved in the treatment will increase their success of staying sober out in the community once they leave the program.
Does the patient themselves have to call and make an appointment, or are family or loved ones, friends able to call and make an appointment for this person?
For an adult, anyone that's 18 or over, they have to call to make the appointment. Otherwise, our schedule would be full of appointments where family felt that they needed treatment, but they weren't ready to accept the treatment, and we would have nobody coming in. So they have to be able to make the appointment for themselves.
So what questions might you ask yourself if you're starting to wonder if maybe you've stepped over that line from using to addiction?
There's a self-assessment, very quick, easy to do. It's only 8 questions long that you could ask yourself or someone that you know that's exhibiting some of these symptoms. And it's real easy to remember, but they involve on your social activities. Do most of your social activities involve drinking or drug use? Do Do you have to use more of the substance than you did in the past to get the same effect? Do you ever regret your behavior following drug use or drinking? Have you ever forgotten part of or all of an evening due to drug use or drinking? Have you ever missed work or homework assignments due to drug use or drinking? Do you have personal or legal or financial problems due to drug use or drinking? And do you have family members who either drink or use drug, and have you ever tried to stop and not been successful? So if you've answered yes to several of those questions, then you should get an evaluation.
Well, thank you so much, Donna, for being here today. Thank you for all of this valuable information. It was a pleasure having you.
You're welcome. Thank you for having me.
Peace River Center's Substance Use Services Program is certified and licensed by the state of Florida and known for being a practical, effective, and evidence-based approach. They provide help for alcohol and drug abusing adolescents and adults, as well as their families. Their program features an abstinence-based treatment program model that focuses on the development of healthy behaviors and lifestyle choices. Each person has exceptional individual strengths. Their goal is to help identify and build upon those unique strengths. For more information on substance use disorder services available through Peace River Center, give them a call at 863-248-3311 or look them up on the web at www.peacerivercenter.org.